All right, good morning, everyone. Well, we'll go ahead and get started. Want to welcome everybody to the Region-wide Community Information Exchange Kick Off Webinar. Good morning. Thank you for being here today. It's so great to have many organizations and partners represented here. I know some people are still joining on and may join midway throughout the webinar, so welcome. My name is Mervyn Dino. I serve as the Assistant Commissioner for the Bureau of Community Health at the Chicago Department of Public Health. We're happy to be holding this space with all of you, along with the Cook County Bureau of Economic Development and the Illinois Public Health Institute, to officially bring everyone to this starting line for this project of the Region-wide Community Information Exchange as we start to build out what a community information exchange might look like, serving Chicago and Cook County residents. We appreciate your time here because we know that these moments in particular are incredibly busy. For many of you who are attending today, we know it's a challenging time for those who are working on the ground daily to safeguard the health and well-being of our residents, both for longtime residents experiencing homelessness, as well as our new arrivals from the southern border. So just to give some background on Community Information Exchange, and you'll hear more of that from our panelists today. So once operational, this is one of many different approaches to improve systems of care and safety nets for people in our city and county by building a data bridge that enables person-centered coordination and delivery of services across the continuum, with equity, of course, at the center of this work. We also want to acknowledge the many people and organizations whose efforts and recommendations have brought us this far. Many of you are attending today, and we appreciate you. We want to give you a big shout out, everyone from governmental agencies to healthcare providers, local nonprofits, and the homeless services community, and know that we will be shaping this work with you. So in the next hour, you'll meet our team. You'll hear about what a CIE is. There'll be some background information on a CIE, how it may support you and your work in the future, and how the city and county aim to bring partners together as we commence this important work. So I will stop there and turn it over to April Walton from our CDPH team to take us through an introduction exercise.
Thank you, Mervyn. Special welcome to everyone for joining our region-wide community kickoff information webinar today. At this time, we want to hear from you. Please add your name and organization in the chat. Also, please tell us what you are hoping to learn about a CIE from today's webinar. At the bottom of the screen, please use the Q&A button to ask questions throughout the webinar. Questions will be answered during the Q&A portion of this webinar. Again, thank you for joining. I will now hand it off to Waldo Michaels Carrasco, who will review our webinar logistics for today's session. Thank you.
Thank you, April. Good morning, everyone. I'm Waldo Michaels Carrasco with the Center for Health Information Sharing and Innovation at the Illinois Public Health Institute. We want to, again, welcome everyone and kind of cover some logistics for today's webinar. We really appreciate that you're all here today and that you've made the time to learn about the CIE project. We would ask, as April indicated, that you use the Q&A function at the bottom of the screen to submit questions throughout. We'll have a question and answer period at the end. And only use the chat feature to introduce yourself as April requested. This is an information session. We are going to try and share as much as we know today with you. So we ask that you please be respectful and ask a lot of questions, and we'll try to answer as many as we can, but that this is a respectful space and that we ask that everyone comport themselves accordingly. Finally, we want to remind everyone that this is being recorded to share with folks who may not be able to join us today and want to learn about this later. If you have issues with being recorded, please feel free to log off and we'll make information available for you later on. Thank you, and I will now pass it on to Dominic Toshi from the Cook County Bureau of Economic Development. Dom?
Thanks, Waldo. Good morning, everyone. I just want to echo the welcome from Mervyn. I'm Dominic Toshi, Deputy Bureau Chief at the Cook County Bureau of Economic Development. And we are a county entity that is helping shepherd this CIE work forward. And thanks again for joining. I want to turn it over to my colleague, Dina Al-Khatib.
Good morning, everyone. I'm Dina Al-Khatib. I'm a project director here at the Cook County Bureau of Economic Development, overseeing the CIE work. And again, just want to echo the thanks for everybody joining us and excited to kick off this initiative today. I think we can go to the next slide.
Thanks, Dina. So at this point, we'd like to take a moment to do a Zoom poll and ask folks to tell us what area of the homeless services spectrum you represent, or your organization represents in the community or in the region. We're getting a lot of activity coming in. We may have a problem displaying this, but I can tell you right now that there's about 39% of community-based organizations and nonprofits leading the group, with government and public entities coming in behind that at about 20. It's still fluctuating, and healthcare providers coming in around 24%. So we have a lot of healthcare, a lot of public governmental entities, mostly still community-based organizations, and surprisingly, only about 3% of folks reporting that they're housing providers. And then we have a 15% other. So I think it's stabilizing now, and yeah, it looks like community-based organizations are squarely in at 35%, government public entities at 23%, healthcare at 22%, housing providers 3%, business and corporate at 2%, and other at 15%. So that just gives you an idea of who's in the audience and who's part of the discussion. We will now move on to a little bit more background on how this project originated, and I'll turn it back over to Dom and Mervyn.
All right, thanks again, Waldo. It's great to have such a great cross-section of folks participating, and I don't know, hopefully it's true for everybody. I just saw the poll results pop up on my screen. So again, thanks to everybody for joining this morning. Again, I'm Dom Tassi with the County Bureau of Economic Development, and I've been working on community development with the county for over a decade, and in that time, I've done a lot of work on social services within suburban Cook and on homeless services in particular. I'm excited we're kicking off this work around a CIE, but I'm excited for two other reasons today as well. I'm excited about the progress of 211 Metro Chicago, which was launched in January and just recently reached over 100,000 contacts from residents across Cook County. And I'm excited about the growing partnership between the county and the city of Chicago, first on 211 Metro Chicago, and now on this community information exchange effort. We engaged in some exploratory work about a year ago and looked at CIEs around the country, and it was pretty clear that this was something that we should pursue. So the county and city are partnering to launch the initial planning and development of a region-wide CIE, which is a care coordination platform that connects healthcare and social service providers. You'll hear more about what a CIE is in a little bit, but one thing I want to highlight is that when we say region, we're talking initially about Chicago and suburban Cook. We also know that much work has been done in this space, and we want to leverage that expertise and past experience as we dig into this work. We want to build on promising practices and lessons learned and not reinvent the wheel. I want to thank everyone who participated in those exploratory discussions and acknowledge the many people and organizations whose efforts have propelled us this far. Everyone from governmental agencies to healthcare providers to local nonprofits and the homeless services community. And know that we will be shaping this work with you We need you to be part of this work and this process, and more on that later. I get excited when I think about the potential of a community information exchange. I think about a meeting I was in not long ago, totally unrelated to a CIE, where I heard a provider talk about how helpful it would be if a hospital that was discharging one of their homeless clients knew to reach out to that provider at that critical point in time. That's one of many examples of ways that a CIE can help. Individuals will benefit from more tailored connections to appropriate services, from a no wrong door system, and from reducing the need for repeated intakes. Organizations will benefit from better awareness of community resources, improved cross-sector coordination, and streamlined referrals and information sharing. And the community at large benefits from more comprehensive data that can identify unmet needs and barriers and drive more informed and equitable resource allocation. One idea that came out of that exploratory work was that a pilot focused on people experiencing homelessness would be an ideal place to start, given the wide range of service areas that are involved in that work. And by this time next year, our goal is to have a fully developed framework for the CIE that takes all stakeholder input into account, so we can advance the full design, rollout, and implementation of a CIE. Now we'd like to talk a little bit about where this work has come from within the city and the county. Next slide, please.
Thanks, Dom. And you would be so kind as to go back just one more slide.
Oh, we might have a slide snafu. Can you go forward one more?
I think go back to just two more slides before this one. I saw it a little bit earlier. It's before this one. Excellent. Okay, awesome.
Oh, there we go.
There it is. Thanks so much, Dom. And to build off of Dom's point here, this work is developed in response to two major reports, and I'll talk a little bit about CDPH work in this space and then turn it over back to Dom. So this report is the product of cross-sector collaboration, including healthcare providers, homeless services and housing providers, advocates, people with lived expertise, and public health organizations, many of whom came together during the height of COVID-19 to implement emergency public health interventions. So as you can see on the left, the report on the recommendations of the Systems Change Collaborative to improve the health of people experiencing homelessness, which was published earlier this year, had formulated 16 recommendations for policy changes, additional capacity, and new investments to strengthen systems of care in areas including care integration, state and federal advocacy in this area, homeless service systems, data systems, and funding and sustainability. So what's central to this work is that we know that there are longstanding inequities and really a confluence of factors that perpetuate disadvantage towards historically disinvested communities. So as part of our focus in keeping equity at the center of this vision and how we intend to operationalize it, we want to ensure that these recommendations are put forward. And CIE was one of those 16 recommendations. So special shout out to CDPH's Office of Health Equity and Health Policies, IPHI, and all those who participate in the collaborative for leading this work. So as you heard from Dom, the CIE pilot aims to leverage the existing 211 Metro Chicago system. There's obviously incredible work that is happening there with County and United Way, but also integrate data and information siloed across multiple systems. So we're excited to start exploring what that work might look like and want to work with all of you and plans to operationalize that in future years. Dom, I will pass it back to you.
Sure, thanks, Mervin. And there were kind of similar discussions happening within the county at around the same time. It was the concept of CIE was being discussed within the county's Equity Fund Task Force, and it ended up as one of the recommendations in the county's Equity Fund report that was published in early 2022 that you can see on the slide. And I personally was able to join the national conference on CIEs last year and learn a lot more about what was happening around the country. And we talked about the launch of 211 earlier this year. We were kind of late to the game in making a 211 available for our residents, but CIE is a newer concept, with the most prominent example being in San Diego, and only being about a decade old. And San Diego actually started with a focus on homelessness. So there's a lot to learn from as we look to be more of a pioneer in this CIE space. And we can go to the next slide, please.
All right, thanks, Tom. So we won't go into too much depth on the data, but we felt it was very important to provide a snapshot of homelessness across Chicago and suburban Cook County. So there's a lot on this slide, but we'll piece together some of the highlights here. Most of these data are from the Department of Family and Support Services, which manages the point-in-time count for Chicago, as well as the Alliance to End Homelessness in Suburban Cook County. So for those of you who may not be familiar with point-in-time count is an annual assessment of sheltered and unsheltered people experiencing homelessness at one point in time in the year. And so for the point-in-time count, those experiencing homelessness includes individuals or families who lack a fixed, regular, or adequate nighttime residence and sleep in a shelter, on the street, or in other places that are not meant for human habitation. So you can see here at the top for the city of Chicago, from 2023's point-in-time count, just over 6,000 people reported to experience homelessness, 84% who were sheltered and 16% who were unsheltered. You can see the city information mostly on this slide. And at the bottom of the slide, you can see the numbers for suburban Cook County. So just over 1,000 were experiencing homelessness, 93% of individuals who are sheltered, individuals who are unsheltered, about 7%. So this is just one snapshot across the city and the county. And what we are forming through the CIE gives us the opportunity to take a deeper dive into these data, specifically with our pilot focus in improving systems of care for people experiencing homelessness. So the last piece I'll just share from a data point of view is that from the 2022 point-in-time count, Chicago and suburban Cook County accounted for over half of people experiencing homelessness in the state. So obviously the magnitude of this issue is clear, and we know that there is data that can guide some of our efforts going forward. So I will stop there and pass it right back to Don again.
Thanks, Mervin. I mentioned before that I'm excited about the county's growing partnership with the city, and we've been able to align our planning efforts to develop a unified region-wide CIE plan, which is not always easy to do. Through a competitive task order selection process with the city, CDPH has awarded IPHI as the lead consultant for the CIE pilot through a grant through the Centers for Disease Control and Prevention. The county's also selected IPHI as our subrecipient to lead this implementation planning phase, utilizing some of the county's American Rescue Plan Act or ARPA funding. Before we hand off to our IPHI colleagues, we want to tell you a little bit about IPHI in case you haven't heard of them. They have a wealth of experience that makes them a great fit for this role. They are the backbone organization for the Alliance of Health Equity, a 30-plus hospital collaborative addressing health equity issues in Chicago and suburban Cook. They facilitated multiple city and county multi-stakeholder collaboratives focused on housing and homelessness, healthcare, mental and behavioral health, food systems, community capacity, and more. And they most recently helped lead the systems change collaborative work that Mervin just described. They also cooperate data across sectors for health, or DASH, which is a national initiative focused on health and social service data sharing. In short, IPHI's deep expertise at the intersection of health equity, data, and homelessness will be crucial for our CIE development. And now I'd like to turn it over to Waldo to introduce the IPHI team.
Thank you, Dob. I'm honored and so blessed to be working with such a team of seasoned professionals in many areas of health information and social information exchange, as well as social and human services, particularly around programs for persons experiencing homelessness, continuums of care, and information sharing across healthcare, public health, and social and human services. On our team at IPHI at the Center for Health Information Sharing and Innovation, I'm joined by Rashida Balagun, Catherine Gillis, and Precious McNeil, who are all with us today. In addition, our outreach engagement communication support team from Apex Direct Incorporated is also with us today, and that is represented by Joy Ross, who's the CEO, Hamdi Ali, who's project director, stakeholder for engagement and outreach, and Suzette Tae Lee, who's a senior project director for stakeholder engagement and outreach as well. We could not do this work without having the best folks that we could collect. So we are really looking forward to bringing this team together and working with the city and the county to design the implementation for this project. You should be hearing from many of the folks on this team in the coming weeks and months as we pull together a lot of the work that we're going to describe here in just a moment. Next slide. Great. So the question that's already kind of coming up in the chat or in the Q&A a bit is, what is a community information exchange, and what specifically can we come to expect, or you know, how would this function in the region? And very clear, you know, succinctly, a CIE is an ecosystem that's comprised of multidisciplinary networks and partners that use a shared language, shared database, and an integrated technology platform to deliver enhanced community care planning. Care planning tools enable partners to integrate data from multiple sources and make bidirectional referrals to create a shared longitudinal record. By focusing on these core components, a CIE enables communities to shift away from reactive approaches to providing care toward proactive, holistic, person-centered care. The real central and important qualities of an effective CIE is the fact that it is person-centered. Aside from the closed loop referral system where persons are screened for their needs and referrals are provided and then followed up on to make sure that they effectively met the needs of those individuals, the data sharing capacity is enhanced through the use of a shared longitudinal record that different agencies and different case managers at different agencies can collectively see, share information on bidirectionally, and contribute to the referral process by seeing what work is being done with another agency and filling in the gaps and coordinating that care. Importantly, though, people who are experiencing homelessness and other social needs, as described by social determinants of health, often are forced to repeat their story or their, you know, what they've been going through to multiple case managers and agencies as they're seeking a multitude of services. This helps remove some of that re-traumatization by only having them explain this one time to one case manager, and then all the other subsequent case managers already have the information. So the person-centeredness of this process is at the core of what makes an effective community exchange program. Next slide, please. So how will this work? How will this process of designing the implementation process actually work over the next couple of months? The phase of work that's ahead of us through the end of fiscal year 2024, which ends in November 30th for the county allocation, and through June 30th for the CDPH allocation, is really ultimately we're responsible to the city and county residents of City of Chicago and Suburban Cook. They will their will and their oversight will be provided by a regional oversight committee, which will be a committee of Cook County and CDPH and City of Chicago agencies and other oversight members who will watch over the development of this process and project, and then provide authority for the IPHI team and Apex team to do the research that we need to develop the initial workflow to design the CIE. This will be done in coordination with an advisory council of folks who have experience in agencies, academia, multiple sectors that interact with or have folks who are experiencing homelessness moving in and out of their programming, as well as work groups around the initial design of what that workflow will look like and the client experience of folks who are moving through these systems. We'll have a data and standards technology work group that will look at how the interface and the database and the technology is produced. We'll have another team looking specifically at questions around legal and governmental frameworks and consent and data use agreements between organizations to share information. And then finally, we'll have a business model and sustainability strategy team that looks at what is the business use case for the development of the CIE and what's its ongoing sustainability plan to make sure that once these investments are made, that they're available to the community moving forward beyond the initial funding. But most importantly, and central to this, is the design of that initial workflow that helps describe how this process should effectively work best for the people experiencing homelessness. Once that is done, all other social needs can be added to that workflow to build out the CIE over time. Let me pass it on now to Dina, who will talk a little bit about what that timeline is going to look like in the coming months and what you can expect. Dina?
Great, thank you, Waldo. As Mervin noted earlier the planning and developing the CIE is really a multi-year effort. And we are with kind of this meeting today, we're really launching the CIE planning process, which is expected to take about 12 months. The goal is really to develop the framework necessary to move into CIE implementation late 2024, early 2025. You'll notice here that the streams of work overlap. It's not a fully linear process, but what we're starting with is our stakeholder engagement. And that includes an in-depth landscape review. As Dom noted earlier, we really want to build on what's already happening both locally and learn from best practices nationally, so we're not reinventing the wheel. We'll be doing a lot of community outreach, stakeholder engagement, and also begin journey mapping to really understand the existing processes and systems, and where there's opportunities for the CIE to help improve those processes. Then starting this spring, we'll really roll into the work that the work groups that Waldo just described, where we'll be really thinking through all the data technology, legal and governance requirements to that will be necessary for the CIE. Then we'll start move into with the input from those working groups and the advisory council, really start building out those frameworks in order to have all of that ready to move into the implementation phase. This is truly it's an aggressive timeline, but I think we have the right partners at the table to make this happen. And again, I think because we'll be building on existing work and not starting from scratch, I think we're really in a good position to move this forward. Next slide. I'm going to turn it back to Waldo to talk about next steps.
Thanks, Dina. So before we get to the question and answer part, here's the call to action. This is what you can be expecting in the coming weeks and months, and certainly your opportunity to volunteer to participate. Even if if we don't reach out, you can always reach out to us. We'll be conducting opportunities to get input from both the community and the sectors that are involved in the development of the CIE, and we need your input, right? So in the upcoming weeks and months, you may be contacted directly by IPHI staff, who you met in the earlier slides, or by our Apex team members, who will ask you to participate in interviews. We want to respect people's time and maximize efficiency. So we're attempting to do as many virtual sessions as possible, keeping them under an hour. So if you are contacted, please do participate, because we need input from as many different sectors and voices in the community to make sure that this is something that is designed, again, to the needs of the people and residents of the city of Chicago and suburban Cook. There will also be opportunities through electronic surveys. You may receive an email that, soliciting your information that way. And finally, as we shared in the kind of organizational structure, you may be asked to serve on an advisory group or subcommittee. So feel free to please serve in that capacity, especially if you have relevant background to the issues that we're discussing. Feel free to reach out and let us know. Additionally, the slides and a one-pager that kind of provides a summary of what we know today, much of what's been shared with you on this webinar today, will be sent out to everyone who registered or was invited to this webinar today. And we'll, as time moves forward, we'll have more information available to you and let you know how you can learn about what's happening. So I think for the Q&A, I'm turning this over to Mervin.
Great, thanks, Waldo. So thanks to everybody who's entered questions so far in the chat. We've got plenty of time to go through your questions today, and we're looking forward to addressing what we do know at this point. And we'll also follow up with a frequently asked questions document for questions we're not able to answer here. So do appreciate you including your questions in this chat here, and please keep them coming. So I'm gonna just go through some of what we've got so far, and then pitch it over to some members of our team to address. So on first glance, we got a couple of questions related to data. We've got some questions about how does the CIE collect data so that inequities and inefficiencies are documented. And similarly, there's a question about data available on the impact of 211 within Cook County to date. So data-centered questions for CIE. Perhaps, Waldo, we can turn to you first, and then others can jump in.
Sure. So as regards to the question specifically about data on inequities and efficiencies around the CIE, because of the interactional nature of what a CIE is designed to do, a lot of the effectiveness or the efficiency of how people move through those systems will be able to be monitored. In large part, again, going back to that workflow development work that will take place in the coming weeks and months, it is to analyze what that client path is, how people move through these systems today, who are the important folks to have or agencies to have involved, what data they're collecting, and part of that is to see if data is collected at an initial point of entry, what can we share with other agencies as people move through these systems so they don't have to keep repeating that information. At the same time, where there is issues of inequity, how can we surface those? So these will all be questions that we're hoping to get input from everyone and through these work groups to incorporate into the design to make this a effective way of surfacing when either efficiency or inequity occur.
Excellent. Thanks, Waldo. The second piece of that question was the impact of 211 within Cook County. Dina or Dam, do you want to touch on that a bit?
This is Dina. I can touch on that. I'm actually, in addition to the CIE being one of my projects, so is 211. So we can definitely share some data on 211 to date. Also, if you go to their website, they have under the resources tab, they have a data dashboard that you can look at. But I will say that one of the things that we're working with the 211 team on is getting more data so that we can start to see where there are gaps in services. And that is something that we're hoping to have more of in and over the next year as they enter their second year of operations. And I'll put the link to the 211 website in the answers. Hopefully, I think if I answer everybody will be able to see that.
Great, thank you, Dina. Looks like we're getting a couple questions about how CIE could look like. So a specific example of what CIE could really look like in action. Seeing a couple of questions about that. Waldo, is that something you want to take on first, and then others can jump in?
Absolutely. Thanks, Marvin. So a real world experience or example of what this could look like. And I'm going to go ahead and throw another question that I saw in the Q&A in here because we could probably answer these together. What's called in computer interface development a use case, or the problem that the city and county are trying to solve is initially been chosen to be homelessness and or people experiencing homelessness. And this is important because this is often the first workflow that's selected by CIEs when they're developed in different parts of the country, because it is so multi-sectoral, right? So here's the example of what's happening. An individual shows up to a food pantry, let's say, and says, look, I have got 2 kids in the car outside. We haven't eaten in the last day or so. Really need to get them some food. I would prefer it to be hot, warm food because it's cold, and they don't have a lot of coats, and we're out of gas. So in that moment, that person just laid out several social needs that they and their family are experiencing at that moment. Chief amongst which is that they need food, but they need food, which they'll probably get at the pantry or at a local kitchen. But the fact that they're in their car, living in their car with no heat, is both an economic issue, it's a housing issue. By selecting people experiencing homelessness, it is going to look at that workflow for homelessness, but as you can see, these things immediately emerge with other social needs or sectors that are associated with it. So a lot of folks who are working in continuums of care or with homeless services often have to do screening for a variety of social services. While we are concentrating on that social need, the particular social need of people experiencing homelessness or the need for emergency housing, immediately we start moving into other social needs and other workflows. And that is, while homelessness is the primary, we're going to rapidly be moving into some of these other areas, which are adjacent to and interactive with homelessness. But that will make it easier for that point of entry, that whether it's the food pantry, whether it's the homelessness bureau, whichever agency it is that's in the CIE network, they'll be able to capture that information, share that information, and then immediately deal with the primary, the secondary, and all tertiary social needs through that network. So I hope that gives you a little bit of an idea, and we'll be providing more information on how these networks are articulated in the coming weeks and months.
That's great. Thanks all. Clearly, there's going to be an impact to the safety net, and to bring data together in a meaningful way that works across systems is critical, as you can see, to this effort. We're getting a question, and I know we've got plenty of time for Q&A, so keep the questions coming. We're getting a question about enrollment in health insurance and other public benefits included as another part of the community information exchange. Those programs are so critical, they should be explicitly named in the model. So I'll take this one on first, and then others can, of course, chime in too. So thanks for this. I think clearly there's a need to harmonize systems between health insurance with Medicaid and Medicaid managed care in particular. We know Illinois has a very robust system for Medicaid coverage and care coordination, but there are opportunities to modernize data. I think we've seen this example illuminated through the current Medicaid unwinding. As many of you probably know, we've seen several and thousands of people lose coverage in the state so far due to the Medicaid unwinding and the end of the continuous coverage provision. I think it's illuminated several opportunities for partnerships between the city and state. At the CDPH level, we anticipate that close to 175,000 Chicagoans could be disenrolled from Medicaid throughout the next 6 months as part of the end of the COVID-19 public health emergency. So this is one example of how we're working to bring systems together. I think the community information exchange can importantly elevate some of the work that we're doing in terms of how are we reaching people experiencing homelessness to ensure that they are being notified of renewals for Medicaid when they're up for redetermination. And I think it also gives us opportunities to work more closely with managed care organizations too. So I think we've got a lot of opportunities in this space. Would anyone else want to jump in on anything related to health insurance and public benefits as it relates to CIE? All right. Hearing others.
Mervin, I was just going to mention that one of the things that has been found in other states and municipalities that have established CIEs is that because of the important role of the payers, particularly the Medicaid provider insurance organizations, who have a large part of their population who are either Medicaid or Medicare or dual eligibles that are part of the homeless population, that the ability to find these folks, which oftentimes is, they disappear from their care management because they don't know they're homeless, so they have no way of really contacting them either by phone or through an address, that this allows them to reintegrate them into that care management again, and when they have lost benefits, to get them signed up again because they actively want to care for these folks. They have a responsibility contractually with the state to do that. So CIE actually provides a far more efficient way of reintegrating those beneficiaries back into the insurance coverage than if you don't have a CIE or some kind of network like that.
Thanks, Waldo. That reintegration to the system and the additional entry points are really important. I think there's going to be an impact to managed care providers as well as case managers who are really trying to make sure that people are getting connected and stay connected. And as we know, given the transient nature of people experiencing homelessness, we understand that it's going to be very difficult to track people when it comes down to ensuring that people are getting all the information they need relative to renewals, care-related issues. And so the increased visibility to information is important. Thanks for that question. We're getting a question, a really important one here about, so response is, I love this idea of reducing trauma. In other words, person experiencing homelessness only has to report it one time. But will case managers be funded so that they truly have time to review it? So many case managers are not paid competitive wages, so people don't stay in jobs, and turnover contributes to lack of care. for both staff and clients and have too many clients to keep track of? Yeah, thanks for this question. I think we're certainly hearing from this that capacity is a concern. There are workforce considerations that we have to be mindful of here. Waldo, and maybe if county colleagues want to jump in, what could the potential impact of CIE be in terms of rebalancing workloads, supporting case managers and some of their frontline interactions with clients and patients and community members experiencing homelessness? And also how that relates to reducing re-traumatization.
I'll be happy to start if someone else wants to jump in. But certainly in our initial design and kind of budgeting, we do want to account for the fact that this is, just having conversations with some of these folks at different agencies and at different COCs who are managing, for example, the homeless management information systems already, that this is a time that we're taking from them. And in some cases, working on the design and testing these things is going to take more additional time from them, but then also, divert them possibly from some of the work they're doing. So we are trying to account for that in the funding and how things are being designed to reduce the impact to their existing workloads, to provide additional resources and personnel to help cover some of that demand that will come. You can't build or design something without putting some work into it, and that is, certainly asking already busy people to do a bit more before efficiency can kind of kick in. So that'll be part of that. The other thing that I would say is part of the financial and sustainability model that we're trying to build, or framework that we're trying to build through that work group and contractors that we're bringing in to help with this, is to see that, to understand that the CIE is not a machine or a piece of technology or a platform sitting in a room someplace in a new organization that's going to be built. It's a network. It's the existing network already of all of these organizations across Chicago and suburban Cook who are doing this work today, and that this is the sustainability of the CIE is completely dependent on the sustainability and the success of the agencies that participate in the CIE. So part of that sustainability and financial development has to be those organizations who are participating and contributing to it as well. So we'll be taking those things into consideration in those discussions and seeing how we can create a comprehensive financial sustainability plan for the region, not just for the CIE as a unit or organization.
And Mervyn, I can jump in here. This is Dom from Cook County. I think I kind of hear two aspects in this question. In Waldo, I think you talked a lot about some of the impacts of participating in the CIE development and the time it'll take from participating agencies to lend your expertise and be part of this effort. I think more broadly on some of the case management need that I was hearing identified in that question. The county is a funder of social services, and I think one of the ways I'm viewing this is as we learn about gaps in this process, it's something that the county could use, and I would imagine the city might feel similarly if we're identifying some gaps where some funding could help with some challenges and capacity issues. That's the kind of thing that we would want to learn from this project, and it may not come explicitly through the CIE process, but it could lift up that issue, and then the county and other partners could look at where funding could come in to help address some of those gaps.
All right, thanks all. Getting a couple questions now about the role of All Chicago and the homeless management information system. And I know we've got a lot of staff from All Chicago on today. Really appreciate that. We know you do so much work in this space, and we know that we'll work closely with you on this. We're getting a question about how doesn't this duplicate the work of CES/HMIS via All Chicago? And similarly, there's a question about the role of All Chicago in particular. So Waldo, can we go to you first and then others can jump in?
Absolutely. So the work of All Chicago is super important, as is the work of any COC in the country. But that work primarily, and its technology backbone and data set, known as the Homeless Management Information System data set and system, are really trained to work, primarily towards the satisfaction or addressing the needs and case management needs of persons experiencing homelessness or housing insecurity. The HMIS system does capture a lot of social needs, but it's not designed to do closed loop referrals or really shared case management. Now, that is not to say that other agencies who are part of the COC cannot see into what's in the HMIS system, but the HMIS system is really, any HMIS system is really customized to the needs of the workflows of the agencies working on homelessness and housing. What the difference with the CIE is that while it's working with healthcare providers, with housing providers, with food and nutritional providers, transportation, while it's working with all of these different providers, it is interacting with their systems. So this would interact with All Chicago and the Suburban Cook COC's HMIS instances, and exchange information without having to duplicate or interrupt the workflows that are already that have been designed and deployed in all of those agencies and in all of those sectors. So it's really a next generation of information sharing that would be far more akin to, for those of you who are familiar with the exchange of health information, and when, if you've heard of public health data modernization, it is to get to that next level of interoperability and data exchange in order to improve efficiency and effectiveness in those systems. So it doesn't interfere with, it doesn't duplicate, it's really to create a next level of interoperability and effectiveness with All Chicago's HMIS system and all the other systems for the multiple sectors that will be involved in the CIE network.
Great, thanks. I think we've got time for probably one more question, I think. So this one's a really important one. I do think should be lifted up here, is the role of people experiencing homelessness themselves in this conversation to ensure that they're able to consent fully, ensure that they don't have to have consent to their data participating. So I hear two pieces of this question. How will CIE be explained to people experiencing homelessness, perhaps in settings of care? And then second, the privacy preserving piece about consent for participation in the community information exchange. So I'll just start by adding something that may not be directly related to this question operationally, but an important piece to this work that can help answer and elucidate how we get to the answer and how we get to a response for this. So we know we can't do this work without building meaningful connections with people experiencing homelessness, and specifically people with lived expertise, and ensuring that they're part of this decision making. I think the consultants that we will bring on, who are people with lived expertise, can help inform how we approach this from an operations point of view, from a provider to patient, client, community member conversation. So throughout the CIE's development, we would want them to advise us on what is the best way to approach them. As part of our proposed governance structure, we will have a legal and privacy arm that is going to be looking at this specifically around consent. So we will be exploring that. I know IPHI has already developed some strategies around that. So our governance is our decision-making body, and I know we've got lessons learned from how we've engaged with people with lived expertise through our systems change collaborative, and IPHI has been working on this for quite some time. So we'll certainly lean on them to figure out how do we best ensure that this work is privacy preserving, but it's also trauma informed, and ensures that data are being shared across the continuum, as Waldo has been describing. Anything else to add on that from anybody?
Just briefly that, while there's only so much information that we could actually include on the slides or in today's presentation, I will call out that there will be opportunities for community conversations on this. We will be hopefully here as we're moving through reaching out to and having conversations with organizations. We'll also be having community level discussions and discussions specifically that we'll try to invite in persons with lived expertise, particularly in homelessness in the region, as an ongoing activity. We're not just going to solicit information at the beginning, but to Mervin's point, the inclusion of community members throughout this entire process into the actual development and assessment of ongoing effectiveness will be opportunities for those community conversations to continue.
Thank you. So I know we're coming to the end of our hour here, and I know we've got questions that I still think we can address perhaps through our FAQs document, which we will send to everybody who's attending and has registered for today. So thank you for these questions. They're important pieces here that we will circle back with you all on, just to make sure that these are being addressed. So be on the lookout for that. Appreciate all that our county partners and IPHI partners have done here on this Q&A. And I will stop there, hand it over to Dom to close us out.
Thanks, Mervin. Mainly want to thank everybody for coming out. It's great to have over 75 folks join today. Thanks for the great questions. For those we didn't get to, as Mervin said, we will share out answers and thoughts in follow-up. And we'll keep you posted on where to find information about the project. We'll have a project website up at some point in the near future that can host some of this information. I might lift up briefly one question I saw in the Q&A about the difference between kind of contacting Catherine around interest on the interviews versus Rashidat on the advisory group. And really just want to say that that's, we want to talk to any of you that are interested and learn from your expertise, and that outreach will be happening. But not everyone we talk to may want to or have the time and space to participate on one of the groups or subcommittees. So I think that's where it's a question of what you're open to, but you can certainly signal your interest in both of those things. Feel free, as Waldo had said, to reach out proactively, but we'll also be reaching out for conversations and next steps. And again, thank you for joining today, and thank you in advance for participating as we roll out this work. Take care and have a great rest of your Friday.